What's the role of NCR, Neuro Cranial Restructuring, in the orthotropic treatment process? It's only 2 years ago that I really found out about NCR, and from a patient that walked in to see me who was under therapy, had been treated in Germany and wanted to move to the UK, and was interested to see whether I could take over her orthodontic treatment while she was being treated by NCR. I was fascinated and went on to meet Dean Howell, talk to him at length on the internet, and of course meet Ian Headley, who now works within our surgery. What first struck me about the concept was how similar the etiological, that's the cause, the pathological, that's the process of it, was to orthodontics, or our understanding of the problem underneath that we were treating. They were so similar that I felt there was clearly gains to be made by contributing the two of them together. And we're examining by casework what achievements we can make. But essentially, orthotropics, is about attempting to change facial growth or facial shape. And it's doing that by changing posture and muscle strength. But to change posture, it's almost essential for adults to change structure as well. And this is what NCR is doing. NCR has been focusing on face pulling. It's focusing on trying to take the maxilla up and forwards. But with an orthotropics, we feel the seat of the problem is often the maxilla. Ideally, faces grow forwards. And unideally, because most people in the modern world, our faces are falling down. It's usually the maxilla that's falling down, and the mandible is hinging underneath it. And as the mandible and the maxilla hinge down, that leaves less tongue space and less airway space, and the compensatory mechanisms lead to the various malocclusions of forward head posture and a lot of associated problems with not only these compensations, but a change in the facial morphology, the facial shape. Now, NCR has come from a slightly different angle, but it's coming to the same conclusion that the maxilla needs to come up and forwards. Now, the maxilla sits on top of the tongue and the teeth. So you have the indirect action of the bite forces from the masticatory muscles driving through the teeth onto the maxilla. So those are the indirect forces on the maxilla. And the direct forces is the tongue on the maxilla. And these two systems control the position of the maxilla more or less. But if you can widen the maxilla, lengthen the maxilla, and move the maxilla up and forwards, you then change the structure. And form, or structure, and function, they go hand in hand. You can say structure follows form, form follows function, and function follows form. And to change one, you can integrally change the other. And the initial starting point of much of our orthotropics, both for children and adults, is the initial phase to change the structure before we can change the posture or function. Now, gaining that change in structure can be attained by physically widening the maxilla and pushing the front teeth forwards, but also by using some of the head braces, the headgear systems that we're developing and have already been developing. There's the Face Max already developed by the NCR, and there's the Mew Vector that we're working on now. Both systems effectively trying to do the same thing, of moving that mid-face up and forwards. So trying to move the mandible up is easy if the maxilla moves up out of the way. So realistically, anything that affects the midface, that would disturb the midface, and disturb it cleverly in the right way, would help these head braces to move the midface forwards and upwards. And this is where NCR comes in. NCR also has a very innovative way of looking at the whole body function and symmetry, and the role of the parasympathetic and the sympathetic nerve system that so far we have not really analysed in orthotropics. But the more we can bring in that can work, the better, and it's worth trying new therapies. Not long ago, physiotherapy was considered an alternative form of treatment that was outside the realms of the National Health and Hospitals and considered very suspicious by many people. And now it's standard treatment. So what next will come into the mix of what's considered standard treatment? I think NCR has great potential and possibilities. And we're mixing this with our adult therapy to see how much change in the midface we can gain, to see how much change in the whole facial structure we can gain on the back of this.